I guess the reason why Ian asked me to come here tonight is that I've been involved in research for many years, and now I'm somehow on the implementers side with the Global Fund. So let me leave you with a few remarks on operational research. Let me first say that I strongly believe that the dominant feature of this conference is achievements in scaling up prevention and treatment. And of course the most obvious achievement here is the achievement in scaling up treatment to 3 million people. But as we look at those numbers and as we scale up, I think we all will agree that we have shown little or at least insufficient ability to learn the lessons, to learn as we are doing. And looking back at my years in research, and actually the last 9 years, 1998 to 2007, when I was the director of the National AIDS Research Agency in France, from where I am now, I realized the disconnect that exists between the research community and the implementers community. Very obvious disconnect. Implementers invest very little into data collection, very little into validation of data, very little in linking with researchers, being them clinical researchers or social sciences. I see the researchers trying to reach the implementers. I don't see the implementers going and trying and reach the scientists. The scientists on their side, I think, show insufficient efforts when it comes to using some of the indicators that the countries are producing as they scale up. They would rather come with their own set of indicators or specific objectives in their research based on what they have conceived in a hypothesis-driven model of research, rather than they would primarily look at what is actually available in the country in terms of outputs, outcomes, public health indicators. And of course, and also let us be very open, I think the researchers are really very poor at disseminating the information. So once the paper is in press, it's almost forgotten. And also particularly poor at actually translating or helping translating the results of the research into guidelines and into policy. So as we scale up, we clearly need to revisit the way we see the research, or the research that goes alongside program implementation. That doesn't mean that we have to slow down in other areas of research, of course. I was just telling Ian that at this particular conference, I think we've gained extraordinary momentum in scaling up results of scaling up treatment, in prevention, in attention to sexual minorities, to human rights, in closing the debate between health systems versus vertical disease-oriented programs. But there hasn't been much science, and we need to continue an ongoing and major effort, obviously, in basic science, in biomedical research, in clinical research, in social economic sciences, because slowing down such efforts would obviously have a very negative impact on patients and on our future ability to scale up prevention and treatment. As I also was saying to Ian, I was struck, for example, yesterday listening to Bob Sidicono by this new hypothesis that antiretroviral combinations could, let's put it cautiously, totally suppress ongoing viral replications. Because this shows, if this is verified, how in fact our thinking can evolve, our thinking about treatment could constantly evolve with new pathogenic hypotheses. that conventional, let's call it conventional research, basic science, clinical trials, will remain essential for the future when it comes to improving PMTCT protocols, testing the future of PrEP, and of course designing and testing vaccine candidates. But from what I said so far, I think we all agree, and that's why we're here tonight, and that's what you're asking with your consortium. We need also a new kind of research. Let's call it operational research or implementation research or health sciences delivery research that would be conducted alongside programs delivering prevention and treatment and in real time. I don't think we're inventing something really new here, but I would say we're trying to elevate operational research, which wasn't called as such, to the level where it should be, given the human, the economic, the societal, and the developmental dimension and impact of what we're doing as we scale up prevention and treatment in AIDS. Because if we now look back to the last 5 years, we've been scaling up therapy, but at the same time, a number of researchers, or actually a number of multidisciplinary research teams, have allowed us, the AIDS community, to come with evidence that contradicted a number of the predictions that some people, even some of the most renowned scientists, were putting forward in the early 2000s. The prediction that if we hurry too much with scaling up, we will face a wave of resistance and a second wave of resistant HIV epidemic, that patients would not adhere to treatment, that drugs will remain too expensive, that treatment will not be possible because health systems are too weak. All of that has been contradicted by evidence gathered alongside the programs that were being implemented. So operational research is not something new, but it's something that we clearly have to come together, as I was saying, to elevate now at a different level. That operational research is essential, one, to inform the program implementers about the successes and the failures of their programs, so that as to increase efficiency, and also to monitor as the programs are implemented some other issues, such as, for example, are the programs really contributing to equity in access to treatment? Those programs should also serve to learn through experience between programs and between countries. And then, of course, they will provide evidence for results, evidence for impact, and as now being involved on a daily basis in fundraising large amounts of funds for treatment worldwide, I do see the challenges if we do not produce strong, robust evidence of impact. We will be in trouble because we're facing challenges. We're facing the challenges of people who claim that disease-targeted programs do not contribute to health system strengthening, do not contribute to global health or to economic and human development. And of course, we will face the challenge, increasing challenge of new priorities such as climate change.